Good afternoon, everyone. Can everyone hear me okay? Thumbs up, anyone? Great. Thank you, Adam.
I think they're all muted for some reason.
Okay. Oh, yes. So thank you for the thumbs up. Wonderful. And thank you all for being here this afternoon. I am super duper excited. We have Lynn Fairfield-Sonn, the Senior Regional Philanthropy Officer, for the American Red Cross in Connecticut and Rhode Island region. And Lynn is a wonderful, wonderful person. American Red Cross is a wonderful community partner. Today, she will highlight the mission of the American Red Cross, both locally and nationally, and will present on the collective response to the Connecticut floods last August, as well as how the American Red Cross responds to home fires and address trauma to those impacted in those disasters. So without everyone's time is precious, so without holding up any longer, I would like to present to you Lynn from the American Red Cross. Thank you so much, Lynn, for being here. We're super excited to hear from you.
Thank you, Renee. And we're very honored to be invited to do the Lunch and Learn. So I'm going to start. Can you see my slide, Renee? Okay, thank you. So again, thank you very much. And I want to talk to you a little bit about the mission of the Red Cross and what we're doing across the world, across the country, and in the towns served by the United Way of Greater Waterbury, as well as Connecticut. Our mission is to prevent and alleviate human suffering. And we do this, whether it's human suffering because of unexpected emergencies, chronic illnesses, medical emergencies. It can be any kinds of military emergencies where people need to get home in time. We are there. And how do we do this? How do we provide our services? Well, we're very blessed. We have an incredible volunteer group. So it's through the power of our volunteers and the generosity of our donors that we're able to fulfill our mission. So every day in our neighborhoods and communities and around the world, the Red Cross is there. And we are doing things 24 hours a day, 7 days a week. You may not see us. We're not always in the most visible neighborhoods, but we are there and we are responding. And I think many times people are surprised because we don't necessarily have a physical address in your community, but that does not mean that we don't have volunteers and that we don't respond, because we do. Every day, our work impacts lives. And this is just an idea how we impact lives. It's 44 people are assisted every minute by the Red Cross, whether it's because of blood donations, because of responses to emergencies such as home fires or floods, helping the military with communications, different services, blood transfusions. And we also provide a lot of health and safety training across the country. And internationally, we do a lot of work, but we also provide vaccinations, measles or rubella vaccinations internationally. Our services fall into primarily these 5 categories, and I'm going to talk a little bit about each one of them today, with the focus probably more on domestic. So disaster services are definitely the services that we provide the most in your region or in the town served by the United Way of Greater Waterbury. We also provide services to both active and retired military and their families. And again, this is not always something that people are aware of. Blood services, you are an incredible group in your towns who hold blood drives. And we'll talk a little bit about some of the work that we do in blood services and training services. Again, we want people to be as prepared as they can to meet emergencies. And so one way to do that is not only through our responses, but also through preparation and getting everyone ready. So in your footprint, in the town served by the United Way of Greater Waterbury, we have a physical site in Southbury, which is our office in quote Region 5, which corresponds with Demas in the state of Connecticut. So we have an office there, and Alexis Zizek is our disaster officer who's stationed there. We have a trailer in Waterbury that has cots and different supplies, because what many people don't know is we are mandated by Congress, and of course it's an unfunded mandate, to provide shelter and mass care in the event of emergencies. So we have 5 shelters in this area pre-positioned, but in the town served by the United Way of Greater Waterbury, we have one in the Waterbury Arts Magnet School. So if there is a hurricane, a flood, whatever the case may be, we have a shelter ready to be opened. We will roll up our trailers, we will unload the cots and all of the supplies that are already pre-positioned. And we have feeding contracts in place so that the people who stay in our shelters will get meals. And we have 102 Red Cross volunteers who are in the towns served by the United Way. In fiscal year 24, and I'm going to talk about our fiscal year, which is July 1st, 2023 to June 30th, 2024, just to give you a framework. In Connecticut last year, we responded to 723 what we call incidents. They can be home fires, they can be floods, they can be building collapses, they can be unexpected emergencies that impact our residents. And we assisted about 3,100 individuals last year, and we provided over 700,000 in direct financial assistance to these families who, again, are not prepared for these emergencies and don't expect them. In your footprint, in the town served by the United Way of Greater Waterbury, we responded to 59 different incidents, home fires, flooding, where we assisted 200, a little over 200 people, and we provided about 39,000 in financial assistance. Most of the families that we assist, first of all, we will assist anyone who needs help. So if the fire department, and we get notified of all the fires, and we do have a deputy officer for the state who will call the fire department or the police department or the emergency response person in that particular town and say, do you need us? Should we come? And they will say, no, it was in a barn, another part of the property, you don't need to come, there's no one displaced. But we will respond within an hour, typically 24/7. A volunteer or two will come with supplies, a blanket, and make sure that that family is safe and has a place to stay. Because our short-term outcomes for us are to make sure that the client's situation is stabilized. You have a place to stay, you have the medications you need, you have food for the next few days, you've got some clothing. Because again, depending on the situation, you may just walk out of your house with the clothes on your back. You don't have a cell phone, you don't have things. Every situation is different, but we respond. We, on the scene, will make a hotel reservation for that family. We will provide them on that scene with a financial assistance card to pay for that lodging, to buy food, to buy whatever things they need. And they can go directly to the hotel and make sure that they have a place to stay that night. The other thing that we provide, so that is the immediate needs. We do that typically while the event is happening. We are the only nonprofit organization other than first responders who actually go to the scene of the fire or the flood and respond immediately. Most others do not. And then what we'll do is once we are sure that the client is stabilized, has a place to stay that night, kids, have things, we'll have blankets for them. We'll have stuffed animals for their children. We do everything we can do to give them as much comfort and care as we can. We will follow up with the family within 24 hours, but we will spend the next couple of weeks making sure that they're on the road to recovery, that they have the prescription sunglasses, that they have recovery envelopes that contain information that will help them begin to prepare to become as whole as they were prior to this emergency. So We also find that many times there's a lot of mental health and spiritual health issues. You've just had one of the worst nights of your life, and you've lost your home or you've lost your pet. You don't know exactly what's happened because of a home fire or flood. And so we want to make sure that we help them, not only physically, but also mentally, emotionally, and spiritually. So we have many retired, interestingly enough, mental health um, professionals who retire, some of who are active, who will work with us and respond and assist those families that experience these traumatic events. Again, just a little bit of the basic needs that we meet, just so you get an idea of the things that you don't think about that you walk out of in an emergency. That's our response, but we do a lot of things to prepare because we had a vice president who always says, hope is not a plan. You do need to have a plan, and you need to think through some of the things that could happen, might happen, and at least have something in your head that you know what to do. So we do a lot of what we call preventative or preparation work. And one of these things is the Red Cross Home Fire Campaign. We will go into homes and install typically 3 or 4 smoke alarms for free. And while we do that, we do work with them on emergency plans. So why do we do this? Because really only 10% of the households, and the statistics have proved this, and it's interesting too, we have a lot of insurance companies who partner with us, but they are only 10% of the households that have appropriate preparedness, including a fire escape plan with their family. And so therefore, what we have done is about 10 years ago has started this campaign where we provide free smoke alarms. But it's not just the installation of smoke alarms. It does include this idea of basic safety tips, things like please do not plug major appliances into extension cords. You need to go directly into the outlet. Do you have a safety plan? If you have several children or several members of your household and there is an emergency, there is a fire, the fire alarm goes off. Do you have a point down the street where you're going to meet so that you know you can do a head count and make sure that you're not sending fire personnel into the home to search for a child who might be at a different neighborhood, a neighbor's house? So these are the kinds of things we want people to think about. Think about a go bag. We love these go bags where you've got a small bag that is ready in case you leave it close to the door or in your car, where you can grab it and leave with your medications, emergency contacts, maybe $100. These are the go bag type things that they talk about. And we do have lists on our website that provide these kinds of details. 46% of Americans, and I suspect this is higher now given the state of the world these days, they do not have the $400 necessary to cover an unexpected emergency. Their budgets just don't have that padding in order to handle it. So that's where we come in with our financial assistance when needed. The other thing I want to tell you too, in calendar year 2024, we saw in Connecticut 14 deaths from home fires, and that was an unusually high number. And we really stepped up our smoke alarm installation, but our emergency planning. And some of the things that we've seen are because of the high cost of housing, we have seen families double and triple up in different accommodations. We've seen what we call illegal apartments that don't necessarily have the appropriate alarms or fire escape situations. And it's not just the Red Cross. I'm sure the fire department and the emergency personnel in your particular towns have seen this as well. But this is driven by the high cost of housing, particularly in our state and around the country. So what do we do to save lives and reduce injuries? We go neighborhood canvassing. So where there has been a significant house fire, many times after the fire, our volunteers, the fire department, again, we collaborate with a lot of different community members. We'll go door to door and knock on people's doors and offer to check and install free smoke alarms and to do emergency plans, because that's the time to really, because goodness knows once you've seen that type of emergency and it's been your neighbor, you may want to make sure that it doesn't happen to your family and that you're prepared. We have a lot of online emergency training, and we have, if you wanted to go to our Red Cross website, which is redcross.org, you'll see a lot of the different opportunities that are available or free resources. We also engage youth. We do have different projects where we go into the schools, where we have Pedro the Penguin Project, and I think I spelled penguin wrong, I apologize. And hands-only CPR is something that we've started now so that people know how to respond in terms of a cardiac arrest or some physical emergency until first responders can arrive. And so we've been doing quite a bit of that. So in Connecticut, last year, we made about 1,500 home visits across the state. We installed over 5,000 smoke alarms, and with 3,800 residents, we made emergency plans and talked about some of the different steps so that the families and the residents can become safer. In the footprint of the United Way of Greater Waterbury, we made 165 home visits, and we installed over 500 alarms. And again, these are free. If you go to redcross.org, there is a toll-free number to call to set up an appointment, and we're happy to do that. And then last April, Waterbury had seen a fairly high number of home fires over about a 12 or 18-month period. So we did what we call a Sound the Alarm Day, and we partnered with Mira, which is a wonderful organization that are bilingual. So for those of us who don't speak Spanish, and I'm one of them, we fanned out across the city in areas where there were vulnerable populations who had seen a fair number of fires, and we knocked on doors, and we visited 105 homes, and we installed about 400 smoke alarms that day. And so this was a Saturday. We discussed about 105 plans with the 105 homes visited, and it was an incredible day. And we did have an impact on those neighborhoods. And what we do is, if the residents aren't home, we leave a door hanger and says that if you would, sorry we missed you, but if you'd like to call us and have smoke alarms installed and emergency planning made, please call this 800 number. So there was follow-up from that as well. Some of the other things we do in the footprint around Greater Waterbury is we partner with other nonprofits. So we were asked Lexus was asked with our volunteers to partner with Connecticut Mission of Mercy. They were doing a free dental clinic in Waterbury, and those are incredibly well attended, and people start lining up in the middle of the night. So we arrived, what we did canteening. So for those who were in line for 3 or 4 or 5 hours, we made sure they had blankets, Mylar blankets. We made sure they had food and drink, and that people were safe prior to entering the dental clinic. And we do different things with, we work in collaboration with nonprofits. We work with the public officials in your towns, particularly your police department, your fire department, your emergency management officials, and public safety. During COVID, there were groups of us who worked with public health in the city of Waterbury, and we canvassed the neighborhoods, sharing COVID information, as well as telling people where they could make appointments for vaccinations. Another service that we provide is what we call service to the armed forces. So I don't know how many of you have had friends or members of your family who've been in the armed forces, but the Red Cross has historically supported military members, veterans, and their families before, during, and after deployments. One of the things we are known for, and again, this is mandated by Congress, and they actually do give us a little funding for this, but we provide emergency communication services that link members of their family with the military who may be deployed. So if, for example, there is a member of your family who may be close to death, and we will work with the military to find that particular service member, document and prove that this is indeed a solid request, Many times we'll help them with financial assistance to fly back home if possible and to get the military member back to their loved ones in times of emergency. We'll also send different communications as well. So those are just some of the things that we do. In the Waterbury area, we had 185 families receive military services that way. And that doesn't include some of the things we do, the pre-deployment briefings with the families. We visit VA hospitals, and we do a lot of different holiday mail for the veterans and for the active military. We also have mental health professionals who work with many of the retired military and also active military families to make sure that they have the support that they need in times of stress. I will ask for questions at the end. So, but if there is something that you think you would like, let me just see if the chat, feel free to put something in the chat and I will try to respond if possible.
Yes, and I have the chat open, Lynn, and I'll be
Okay.
happy to
Thanks,
assist you
Renee,
with
because
that.
I realize
Sure.
I'm talking nonstop here. And
Absolutely.
training services. So we, again, as part of alleviating human services and being prepared, we do provide training with first aid, CPR, AED, defibrillator training, emergency preparedness. We do workplace safety. So one of the things that we do is to ensure that organizations know how to respond in the times of a hurricane or an emergency. Do you have an emergency plan in place to know if your employees are safe? And there's a lot of different resources available on our website, as well as you can request some assistance from our disaster people to work with you and your organization on that. And again, this is all part of our mission for emergency response, prevention, and preparedness. We do caregivers and babysitting training. And last year, in the town served by the United Way of Greater Waterbury, we trained about 3,500 residents. So it's, again, you don't always see us, but we do have different touch points in your communities. You are all a great area and you are very kind to provide blood drives. One thing that people don't always realize is the Red Cross is one of the nation's largest blood collection organizations. We collect about 40% and distribute 40% of the nation's blood supply. There is no such thing as artificial blood. Only human donors can give blood to help other humans. And so many of the procedures, and whether it's a chronic illness or an emergency illness, they really do need to have blood transfusions. And so therefore, we collect the blood supply and we test it. Our Farmington headquarters is the Connecticut headquarters for blood supply. So anywhere in Connecticut where blood is donated, either from a fixed site or a mobile site, the blood is taken to Farmington, many times by volunteer drivers. And we have a whole process where we have huge banks of refrigerators. The blood is tested because we have specific safety testing that we must do. If you know those little tubes that they collect the blood, they do the testing. And then we store it, and then it is distributed to the different hospitals at their request and based on their requirements. In your footprint, you had about 5,000 people who volunteered to donate, and we did collect about 4,300 units of blood. Why the discrepancy? Sometimes your hemoglobin levels or your iron levels aren't high enough. Each unit of blood saves up to about 3 lives. So you really can have an impact. If you cannot give blood, but you have friends who can, please encourage them. It's a very small percentage of the United States population who donate blood. And some people can't. But if you can and you have the ability, please do. One of the other things in Connecticut is that we have the rare blood center in Farmington as well. So there are people with different types of blood types besides you have, A, B, and O, but you have underneath those different antigens that make up a particular blood type, and some of them are unique and rare, and so they need specific blood types if they're undergoing any kind of a medical procedure. And so there are matches with people across the nation who have rare blood who give to other rare blood. In addition, what we find is there's chronic diseases. So for example, sickle cell, that is predominantly a Black and brown disease. And while I can give blood to a sickle cell patient, my antigens are not a terrific match as those who are of Black and brown descent. So we have been doing a lot of work to encourage matches because the patient does better. If you have a chronic disease and you're going to be receiving blood transfusions over a period of time, we want to make sure you're getting the best product to make sure you have the right outcome. So you will see a lot of different PSAs about this and understand that this is why, that we're trying to alleviate human suffering, particularly for those who are suffering medical emergencies. One of the things that we talked about and how Renee and I got discussing this lunch and learn with Jared was the fact that we as a group and the Red Cross, in collaboration with some terrific community programs, responded to those historic floods on August 18th this past summer. And so this is a little bit about the Red Cross response. We set up 2 shelters immediately. Most people did not need the shelters, so we ended up closing those after a few days. But what they did need was they needed people going out and helping them. Some of them could stay in their home, some of them couldn't. So we had 77 trained volunteers. All of our volunteers are trained. That's another point I want to make. If you see a Red Cross volunteer responding, they are trained before they are allowed to go out into the field and help. And so we do have both online training and hands-on training, just to let you know. We provided about 3,600 meals and snacks over that time period as people were recovering. And then we provided cleanup kits to the different households. And you'll see in one of those pictures that white bucket. Those are full of clean supplies. And you say, why do you do that? Well, think about hurricanes or different things where the Walmarts, the Lowe's, the Home Depots, they're all cleaned out right away because everyone's trying to fix their things. So for us to be able to provide some of these different supplies right away to help you mitigate some of the damage can be impactful. We helped about 450 total households that over that period of time. We served 87 individuals with recovery support and its financial assistance, replacement of eyeglasses and subscriptions. Again, depending on the floods, a lot of things that were important to them didn't survive. And we also do something in conjunction with FEMA and other state emergency management is we do damage assessments. Our volunteers are trained to go out and to do a damage assessment so that it enables the homeowner or the resident to apply for assistance at different levels, not only from the Red Cross, but through other levels. And so we did 360 assessments in the various towns. In your footprint, Southbury was the hardest hit. And we worked with the Southbury Senior Center to hold one of our 2 what we call MARCs, or multi-agency resource centers. And this is something that the Red Cross does across the country. We've done it with the wildfires, we've done it with different hurricanes. When there is a certain level of disaster, we will gather all of the nonprofits and FEMA and state and federal, whatever we can do to support those impacted by these emergencies into one room. Think of it as one-stop shopping so that the resident can come in and go from station to station to get the assistance they need. It can be public health officials. We had food banks. We had the United Ways. We had the community foundations. We had just a variety of incredibly supportive nonprofits who stepped in and stepped up. Teams was one of them. So that being said, this is when the community collaboration is at its best. And I have to tell you, in the greater Waterbury area, there is a fabulous group. So just wanted to share that. Switching gears on you. We have free mobile applications, and these are incredible. And I would like to suggest that you download these free on your app. They're for Android or Apple iPhones. Um, they're all fabulous. I think the emergency is great and the first aid is great. I'm a blood donor, so I have the blood donor app. If you have children or grandchildren who swim or are near a body of water, I do suggest our swim app. I'm not sure that's the correct logo. I think they've updated it. We also have pet emergency first aid. And that being said, I have probably too much information, but I do have a son with type 1 diabetes. And so for me to have the first aid app, it tells you what to do in the event of a diabetic incident. And so while I've been trained, having it on your phone to refresh you very quickly has an impact. So now I again want to switch gears away. We really want to be prepared, right? Hope is not a plan. You really do need to think about a plan. So what are you going to do before an emergency? What are you going to go during an emergency? And what are you going to do after the emergency? So I'm just do a quick 3 slides. Before an emergency, if you hear that there is a hurricane coming or a storm coming, and I was saying to Renee earlier, we forget we did have some wildfires this past fall. Now, granted, they were not large, thank heavens, and they weren't in heavily populated areas, but we did have them in Connecticut. So, it's not necessarily something that couldn't happen here given the right conditions. So you want to be prepared. So be informed, figure out what you and your family are going to need in the event of an emergency, build a support network, and develop a plan. What are you going to do, right? What are you going to do if there is a hurricane? Can you go north to a relative that's more inland? What kinds of things? How are you going to communicate with your family? Do you have WhatsApp? Do you have a text chain? Gather the supplies you need and prepare the documents you need. It's not always terrible to get a copy of some of the important documents if it's not the originals and have them in your bag just in case you need them. How do you respond during a disaster? Well, stay informed, make sure your phones are charged, make sure your car is gassed up, know how to take action to protect yourself. Do you stay in your home or do you go? Uh, Again, it depends on where you are. I happen to live on the shoreline. And so for me, if there was a flood coming in based on what I've seen or a hurricane coming in close to where we are, personally, I would leave. But there are people who stay. But what happens is in the middle of a hurricane is first responders can't get to you because they usually stop responding at the height of a storm. So you're on your own if there's an emergency. Locate your public shelters. And again, if you have the emergency app downloaded on your phone, it will tell you based on your zip code where your public shelter is and where you can go to shelter. And then don't be afraid to ask for help. Reach out. People are always willing to help you, and you can always call the Red Cross and the United Way and 211. I mean, there's a lot of really great resources we have. Know how to recover from a flood, from a fire. And one of the things that people have shared is when in doubt, throw it out. After a hurricane, after a flood, after a storm, be very careful of electrocution. If you see downed wires, don't go near them. Only use a generator outdoors and away from windows. Make sure you take pictures of any property damage right afterwards if you happen to be there. It's always good. Cameras are great things, and you can document them on your phone. If you're going to be cleaning out things, make sure you have a glove, mask, and protective clothing so you protect your body because you just sometimes don't know what's in the muck. And lean on your support network for help. We have been very blessed at the Red Cross in Connecticut because we have had the most amazing relationship with the United Way of Greater Waterbury, and we've partnered on a number of different things. And I probably too many for me to remember or share. But we have a great partnership, and we do not receive any federal or state funds for home fire responses or for flood responses or for most of the work we do. So we rely on the generosity of the public, and the United Way of Greater Waterbury and all of their wonderful donors and friends have been incredibly strong supporters of our mission. So at this point, I will stop and say thank you so much for listening to me for the last 30 minutes, and I'll take any questions.
Okay, I'll watch the chat for the questions. And Lynn, thank you, I mean, for all the amazing work. United Way is honored to be a community partner alongside you as a part of our, basic needs impact area. For all the information you shared, it really made me think, looking at your data, your statistics in regards to, how much emergency dollars, do you have, or do you have a plan? So that really is a lot to think about, especially with a lot of the changes going on in our world today.
Well, and the direct financial assistance isn't the cost of maintaining the vehicles and the emergency supplies. We twice a year check our trailers and vans to make sure that we have those supplies in place, that they haven't expired, that we can roll them out in the event of the need for mass shelter, whether it's from, a large disaster or a small disaster.
Mhm.
Okay, so there looks like there's a question in the chat, Logan. Oh, this is a good question. Logan, I think the thing is knowing your family and deciding what is the right thing. So for me, and I know it sounds crazy, I have a list of things, and actually, you can go to our website and I'll put it in the chat. I guess can I add to the chat? I guess I can't. So at any rate, redcross.org has a list. I think one of the things, if you can do it, is to have a 7-day supply of your medication. If you are on particular meds, you should have those in your kit. So if they're in pill form, that's great because you really, you can check them every few months to make sure they're not expired. But for some of the ones, like I'm thinking insulin or things that need to be refrigerated, just make sure you have a plan to grab those. If you are obviously in a fire, don't worry about it. But if it's, if you're leaving because of a larger event, make sure that you do have the medications you need. And the second would be a charger for your phone. That's just me. I don't know if that helped. How do I find out what my blood type is? Well, first of all, there's some really great things that we're doing now at the Red Cross. In fact, this is a beautiful, thank you, Adam, a segue for me to share with you. When you donate blood, if you have the blood app, which you can easily download, there's a couple of key things. It gives you a history of what your blood pressure is over the time, because they take your blood pressure, they take your hemoglobin. And then some of the new things that we're starting in the next 6 months to a year is that, besides Adam, they will tell you what your blood type is. Once you go to donate blood, they will type it. And we are also now we're doing more public health services. So we are finding that there are people who don't necessarily go to the doctors a lot. So we're going to be measuring A1C sugar levels for different populations. And again, it's for you to know. It will be on your app. But what I love about it, it tells me what my iron levels are. It tells me what my blood pressure is, and it tracks it, right? So if you give over time, they chart it so you can see what's going on with yourself. So it's really more of a public health service for individuals who are kind enough to donate their blood. And so that's really helpful. But they will type your blood then, and they will also, and again, they do various tests. So Adam, that would be the best way. Your doctor's office may know if they've done any blood work on you as well. Yes, we install smoke detectors all over the state of Connecticut, actually all over the United States. And it's not certain towns. People just have to call up and ask. It depends. Some towns, and sometimes the fire departments do it. So we don't necessarily do it, or we partner with them. So again, there's a lot of collaboration. But if you call the number at redcross.org for free smoke alarms, a volunteer will come out to your home. We'll check the ones you have. Sometimes it's just battery replacement, and we're glad to do that. Other times, if your smoke alarm, and this is something to check, if your smoke alarm works, but it's over 10 years old, you should replace it, because what they find, it takes longer to react to smoke the older it is, which is why we put in 10-year smoke detectors with 10-year batteries. You can just poke it with the broom to test it, because we don't want anyone on ladders. And again, if you call, and I don't have the number on the top of my head, but it is on the website, people will come out, you make an appointment, they'll come to your home and they'll check everything out for you. And you will get an emergency planning package too. Does that answer everyone's questions?
I believe so. I believe that was the last. Thank you so much again. Oh, wait, we have someone typing. Go ahead, Logan. Oh, thank you for your answers.
I don't know if it helped, Logan, but thank you for the question.
And Lynn, if you have anything to share, I can always send it out too, if you have anything.
And I think, right, I think the website is always good. We have redcross.org, and then if you want it specific to Connecticut, it's redcross.org/CT, and that will take you directly to the Connecticut section of the overall Red Cross. Anyway, thank you for your partnership. And again, no one does it alone, right? Communities need to come together to make sure that we keep each other safe and we help each other in times of need. And that's what, that's why I love our partnership. So,
thank you.
And we at the Red Cross appreciate the United Way.
Thank you. And we appreciate you, and we appreciate everyone who joined us today for today's Lunch and Learn. Have a great rest of the day. Bye-bye.
Thank you, everyone.